I had an accident, I fractured my humerus, and after the surgery, I wore a sling and stayed calm. Then, when I took off the sling, I noticed that my hand was hanging down. I lost strength in my hand, but the fracture was up here. What could have happened? You probably had an injury to the radial nerve. This nerve is responsible for opening the fingers and extending the wrist. If after a humerus bone injury you experienced a dropped hand, it's likely that the nerve was affected either at the time of the accident or during the surgery. If you've lost strength in your hand and it's not recovering, there is a possibility that the injury is a bit more serious and may require some surgical treatment. This type of nerve injury is very common after this fracture because the radial nerve wraps around the bone, and when the bone breaks, it ends up injuring the nerve. The initial treatment is to use a brace to prevent the hand from being limp and also to strengthen this muscle. If you notice that there isn't a good response after the first or second month, we perform an electroneuromyography to check for signs of reinnervation. If we see that there aren't any, that is, if the nerve is cut or severely damaged, then the possibility of surgery needs to be considered, and it may be necessary to perform this procedure early on. When we talk about surgery for a dropped hand, we have two possibilities, either nerve reconstruction in earlier cases or tendon transfer, where we take tendons that close the wrist and fingers and transfer them so they can open the wrist and fingers. This is especially true in more severe or later cases. So if you notice that you've lost strength in your hand after a fracture in your arm, pay attention. The specialist who treats this problem is not the orthopedic surgeon specializing in shoulder and elbow, but the neurosurgeon specializing in peripheral nerves. If you want to know more information and notice that there isn't much about radial nerve injury on the internet, help me out by liking this video and following our channel.